All right, good morning, everybody.
Good morning.
How's this weather feel? Yeah, I see a couple of sweaters out there. First sweater of the season, and nothing wrong with that. So thank you for being here, and welcome to Tuesday Talk. We're going to get started with a couple of announcements, and first up, Chris has a word to share on recycling.
Thank you, Brandon. Last week, Robin Graham mentioned about the black takeout dishes are not recyclable. And one thing we want to make everyone clear to everyone, these are not Regency Oaks rules or LCS's rules. They're waste management rules. They're the ones that are picking up our recycling, so they have set the guidelines. When we can do more, we will. So when they say something has changed, we'll jump on the bandwagon. But this week, paper bags, they're recyclable, yes? Yes, very much so. Unfortunately, we get some of this shredded paper. Guess what Waste Management doesn't want? Shredded paper. So it goes in the trash. Even if it's in a paper bag, it's got to go in the trash. So if you shred your stuff in your apartment, send it down the trash chute. If you don't have a shredder, there's a couple in the computer room, and you can use those and wait. And housekeeping takes care of disposing of them, so it makes it very easy. And next week we'll talk about plastic grocery bags. Thank you.
I'll take a minute to talk to you about some board changes that we got going on. Harry Coble, has had some health issues, so Harry will be resigning the board effective 1 December. So if you see Harry, thank him for his efforts. He's done a super job, and we are going to miss Harry. But we have a fantastic replacement. The replacement is Robin Graham. Robin, do you want to stand up for just a minute? Okay. I'd like you to give a round of applause welcoming her to the board. She'll have her first board experience next Wednesday, so we'll say a little prayer for her, okay? So thank you, Robin, for bringing this her to fill in Harry's term. And we look forward to having you. Okay.
All right, thank you. All right, so Margaret, you're next up.
As you may know or not know, Michelle Wiseman, who's a receptionist in the South Building, has been fighting cancer for over a year, and we would like to make her Christmas a little nicer. We are going to be collecting Christmas cards at the north front desk. There will be a box wrapped like a present. If you could put your cards in there. And Michelle Klopsis is making a giant poster, if you would like to sign that also. We just want to let her know that we love her. Thank you.
That was South Building, right?
South Building.
South Building.
Let's start our discussion on COVID. We'll do the weekly update. How many of you are getting a little nervous? Okay, so a little caution is a good thing. And after we go through the numbers, I hope I can instill just a little bit of confidence that we're okay, and we just need to continue doing exactly what we're doing, and that the numbers here in Pinellas County, Florida, Regency Oaks are all actually fairly encouraging. And this sort of reminds me of the hurricane season, and you have one of the big hurricanes that's sitting right off the Gulf, and it's sort of headed our way, and people get turned into Bay News 9, Panic News 9, and 24/7 they're watching the news, and it just amps up everybody's nerves, and you become more anxious and more ridden with concern. And the numbers, that's what's happening with coronavirus. It's real, it's out there, but it's the top story on every single news network, and it's 24/7 is what you hear. So let's just take a minute to dig into the numbers, and let me share with you my perspective of where we are. Okay, so here's the latest data. on COVID here in the United States. We're at about 13 million cases. Globally, it's 63 million cases. What's encouraging about this map? It was just a couple of weeks ago that all you saw on the map were red dots. You're now beginning to see some yellow. You see a little green up there in the north of Manhattan. I think that may be Delaware. I'm not sure. You see a little white. You notice that California has some blue. And so the white, the blue, the green, the yellow is an indication that the number of cases are beginning to decline across the nation. You can see that there are fewer hot spots. It is true that the hot spots that we have are very hot. We still are looking at COVID rates, infection rates above 20% in most of the Dakotas, Wisconsin, Michigan, Minnesota, those border states. We're beginning to see some issues in Montreal. But the encouraging news here is we are beginning to see a change in some of the colors. Don, let's go all the way over to Florida cases, far left side. So here are the numbers for the state of Florida. We've had 54,000 hospitalizations, and we're going to take a look at the two charts over on the right-hand side. Specifically, I want you to look at resident deaths by date of death, and this is the white chart on the bottom right-hand side, and you can see that it has slowly, steadily been declining. We peaked way back there on about 11, 14, maybe 13, and it's steadily continued to decline. So the lagging indicators are positive here. Let's go to Florida testing. Okay, so here's the chart, and Don, if you take a look at this red line down here at the bottom, this is the positivity rate by cases per week, and go out there to about 11.1 where that dot is. That was the peak, and if you hover right over the dot, it will give us an infection rate. So our positivity rate on 11.1 was 6.88. Now, as Don tracks over the course of the next 4 weeks, let's look how that declines. There's 6.88, and then on 11.3, 11.8, it dropped to 6.61, and then out there on 11.15, it dropped again to 5.76, and then we'll go out to 11.20, and we're 5.61. So that, in my mind, it represents a pretty solid trend. We have 4 consecutive weeks with it falling off. Now, yes, I will grant you that these are not huge numbers. It's not falling off by 1% per week, but the trend is clearly positive, and it is an indicator that we're beginning to turn the curve here. Cases by county. There's one specific thing that I wanted us to take a look at this. We're going to take I'll give you some more figures on county information in just a minute, but 2 things I wanted to point out. Let's look at the hospitalization. Since this thing started back on February 18th, we've had 2,849 hospitalizations in Pinellas County. And so we are nowhere near reaching the maximum capacity of acute care or COVID level beds. So you may have heard recently that the 3 state COVID nursing homes had been closed. And part of that is true, but it represents a change in the approach. Now that we are better able to manage this and the therapeutics are beginning to have an impact on morbidity rates, they've taken a different approach. They've eliminated those COVID skilled nursing centers where, you know, they had 140 beds, and if you have COVID, you got stuck in a general ward with 139 other COVID infected residents. And they've gone with community-based, smaller COVID units. There's 3 or 4 in our immediate area, and so it's just a higher level of care and a much better experience for individuals who need COVID post-acute care, and it's I think, a more humane way of providing it. Here's the other thing I want to point out. So in Pinellas County, we're at 902 deaths, and that's since the start of this back in February. I want you to look at how many non-resident deaths we've had here in Pinellas County, nearly 50%. And those non-resident deaths are, many people believe that they are a large contributor to the increase in COVID numbers. They're fleeing states like New York and the upper Midwest, where the numbers are so high, and they're coming to vacation in Florida and sort of get out of Dodge. And so it's really, really interesting that the positive non-resident count is nearly 50% of the full-time Florida resident count. So just keep that in mind as we start thinking about getting out and about. Let's go over to health metrics. Here are the 4 charts. We look out every single week. The first one, upper left-hand corner in the brown, is the number of influenza-like cases that are presenting in emergency rooms and hospitals. You can see it dropped off. It was beginning to rise 1st of November, and then it backed off about halfway through the month. Here's the great news. This is a leading indicator. These are visits in purple, bottom left-hand side. These are the visits to ERs and hospitals with COVID-like symptoms, and look at how that's been dropping. So really great future indicator of what's going to happen. Documented new cases continuing to rise, but it's the laboratory testing is beginning to decline. There's that small gradual decline, 1/4 percentage point, 1/2 percentage point, week over week basis. That's a trailing indicator. So the numbers are, you can say that all of the numbers that should be going down are going down. We do have that documented new cases that continues to increase, and you can see it's jumped from 1,000 to almost 2,000 on a daily basis. A weekly basis, and so that's something we will continue to try to watch and monitor, because there are new cases still out there. Just to sort of put this in perspective, what happened in the state of Florida yesterday, we had an increase of about 7,000 new cases in Florida, and in Pinellas County that number was an increase of about 300. So out of 1 million people in Pinellas County, we had 300 new cases, and the number of new fatalities here in Pinellas County only went up by 3. And so the numbers look pretty solid there. Our testing yesterday was 5.62%. You saw it was 5.66% in the last week over week comparison. So we also saw that it dropped another 0.4 percentage point over the course of the last 2 days. Our zip code, our specific zip code continues to look really, really good. We only have had 661 residents in Pinellas County admitted to hospital for COVID over the course of this disease. Let's take a look at the number of people who are in quarantine. Residents, we have 14 people in the IL, 9 in skilled nursing, and 23 in the AL. And those are people that we are tracking. The 23 in the AL are part of our routine testing, and they will come off as soon as we get the Thursday or Friday test results. Skilled nursing, same thing. IL, the vast majority of those are either new residents who have moved into Regency Oaks and been put on quarantine, or they're people who have gone to the hospital and they went not for a COVID reason, but came back and they are either on a strict or a loose quarantine. And so when we talk about residents who have actually been diagnosed with COVID, you know from the series of letters that you received over the weekend that we had 2 new COVID positive residents, one in the south, one in the north. Now, both of the residents are now off campus. Both are doing well, and we expect full recoveries for both of them. They got early detection, they got early treatment, the therapeutics did their jobs, and the systems that we have in place to prevent the spread of the virus, they seem to be working as well. And so as we talk about where that exposure and then risk for everybody else comes from, there are some dates that we look at. And we know that 3 days after exposure, you don't start to show symptoms until about day 3. In day 1 through 3, you are not contagious. You don't become contagious until you actually start to show symptoms. And it can vary a little bit. It's between day 3 and 5. But that's when the contagious period of the disease starts. You do not become highly contagious until you're in day 7 through day 10. And so part of our strategy is if we have a resident or a staff member that shows positive and we catch them in day 3 or 4 in the early part of the disease before they are viral and not doing what's called the shedding, then we know that the limited exposure has occurred for the rest of the building. And so that's why you may be asking yourself, well, we had an exposure in the south and we had an exposure in the north. Why doesn't Brant seem really concerned that this is going to somehow spread throughout the building? And that's why, is we were able to detect and get treatment at a very early part of the exposure so that we protected the rest of the building. And so that's part of what we do in contact tracing, is once we have that exposure, we go back and we individually connect with each of the people who had a direct exposure. We do the calculations of when that exposure occurred in terms of a calendar line, and then that determines where we are. So it has been almost 48 hours since our last exposure. And that means, based upon those dates, that if we can get through Thursday of this week without another exposure, then the community will have weathered this storm and will be prepared for the next. So as a consequence of that, one of the things that we did yesterday is we took the large, what everyone calls super spreader events, and we took them off the calendar. And we're creating a bubble, a 4 to 5 day bubble, to get us through Thursday, Friday morning, and make sure that we have no other exposures. That's just another way of putting in a little added protection so that we don't have to shut down dining rooms or stop transportation or limit work orders and housekeeping coming into your apartment. but we take those events that are large events that draw a lot of people, put them in a small room, you put food in front of them, now all of a sudden the masks come down. And so that's why we created this 4-day bubble to give us an added layer of protection and make sure that everyone's going to be safe. So look for Thursday. That's our next big calendar date. And if we can make it through Thursday, we're gonna be just fine. Let's go back to the board. There's one other thing I wanted to share. Go to contact COVID. And so in most cases, COVID is not being brought into the building. It's possible, but we have some really good screening protocol in place. We're stopping everyone, we're asking you questions, we're taking your temperature. If we see something that we're nervous about, we will stop you and not let you come in. So we've got some protocols there, but most of the exposures for congregate housing, whether it's independent living, assisted living, or skilled, is from people that are going out and having exposure. And so this is a chart that sort of rates the exposure risk on a scale of 1 to 10, and it takes routine everyday activities and tells you how risky they are. And so opening the mail, pretty small risk. You know, a lot of people are disinfecting their packages and wiping them down with bleach wipes. It's pretty small risk. It's the smallest risk up there. Getting restaurant takeout, where you do just go and pick it up and bring it back, that's a pretty low risk. Same with pumping gasoline. Let's look at the next level up. Grocery shopping is a little higher risk factor. That's about a 3. There are precautions you really need to pay attention to if you're out grocery shopping. Wiping down the handle of the cart, following the directional arrows that are on the floor, maintaining social distancing in the checkout line. I know the guy behind you is pushing you and wanting to get their stuff on the conveyor belt as soon as they can, but push back. Don't, keep that social distance. That's really important. Going for a walk, run, or bike with others. And so everyone, and this is sort of true, but you have to be careful with this. Being outdoors is less risky than being indoors, but going out and exercising with others outdoors is not a good idea. And the reason for that, anyone know?
Get hot.
You're breathing harder. And as soon as you start breathing harder, you're exhaling harder and you're intaking more. And so that's, if you're going to go out for a walk, do it with a spouse or by yourself. Sitting in a doctor's waiting room is at number 4. When we first started looking at this was way down at number 10. It was one of the riskiest things you could do. But just as we've gotten better at dealing with COVID, so have physicians. And so they have protocols in place. When you get there, you have to call. They may or may not let you in. They'll meet you at the door. They'll check your temperature. They will sit you in a certain seat within their waiting area. They have limits on the number of people who have access. So they've put protocols in place, and they've been pretty successful in moving this up as a safer activity. Having dinner at someone's house, that's a 5, right in the middle of the pack. Shopping at a mall is about a 5 as well. Visiting a relative or a friend in their home, an elderly relative or friend in their home, is a 6, just a little bit higher. Going to a hair salon or a beauty shop is a 7. Eating in a restaurant outside. So we saw where eating in a restaurant inside was a little lower risk. When you go into a restaurant inside, you really need to pay attention. And the important thing with that is if you pull up to a restaurant and you look inside and you see the staff with their mask down or off, or
You see the hostess desk who's smiling brightly as you enter. Turn around and walk out. You don't need to be there. And if it's packed and people aren't wearing their mask, it becomes a very dangerous place to be. So you just have to use good common sense and trust your gut. If you walk in and say, "Oh, I just don't feel very comfortable here," you're probably better off to turn around and go the other way. Eating at one more thing at 7, hugging or shaking hands when greeting a friend. That's really out of vogue these days. It's the fist pump, and certainly don't hug. And then once you fist bump someone, make sure that you're not touching your eyes, your nose, and that you sanitize your hands as soon as you can after greeting someone. Avoid buffets. That's really high up there at number 8. And then number 9, right up there at toward the very top of the 9s, is going to a bar. And so, my first thought on that is I was thinking bars that I used to go to when I was single and 20. It's not those kind of bars. It is those kind of bars, but it's also the bar attached to the restaurant. And you go and you check in, and the waitress says, "Okay, your table will be ready in about 20 minutes. Would you like to go to the bar and have a cocktail?" "Yes, that sounds wonderful." You go to the bar and have a cocktail. For whatever the reason is when you are in a cocktail lounge, the precautions, they just don't seem to be taken as seriously as when you're in the restaurant side. And so the CDC is saying that the cocktail lounge that you and I might visit are as dangerous as the meat markets that a 21-year-old might, that our great-great-grandkids are visiting. And then Don will just finish it up with the tins. It didn't. Okay. So the tins that didn't copy over are getting on an airplane. Try not to do that. Going to a hospital. Hospitals are still struggling with COVID infections within their buildings. They're still recommending that if you have an elective surgery that you put it off and don't take that additional risk. Yes, they have COVID related areas that are set aside and specific, but hospitalization is a big contributing factor to COVID. All right. And Rob, you'll be next.
Well, just a quick one, Brent. It would be helpful if we had that list.
Yes, that was my question.
I can print it and put it on the back of Tuesday Talk, so everyone will get it. We'll just put it right on the back of Tuesday Talk, and so we'll use the front page for the update, and then on the back page we'll have the chart. That's a great idea.
Thank you.
Who else has a question? Oh, I knew Keith would.
Right behind you. Double service.
I have a question on the recycling. I remember talking with you a couple of weeks ago, and you mentioned something about we have money deducted when they have to throw away things that we put in by mistake. I was wondering if you could maybe elaborate on that, because if people knew that we were losing money on recycling because of their carelessness, maybe that would prevent some of the different things that should not be put in the recycle bin.
So recycling is something that we're committed to as an organization, and I know our residents have an interest in doing that as well. We are struggling a little bit with recycling. Waste Management has a policy. They come up to a dumpster, they do a dump, and on the back of their, can you not hear me? Can you hear me now? Okay. So on the back of their dump trucks, they have a camera, and they take a picture of every load. And so we've gotten, we just had another assessment. It was about $1,600. And it's our fifth assessment, so it's something that we've got to get a handle on. We cannot afford to pay $8,000, $9,000, $10,000 worth of fines because all of a sudden it makes recycling not viable. And so it's difficult in the middle of a global pandemic to resolve this issue. How we used to handle it is our maintenance teams, as they were taking out the trash, if they saw something that was not appropriate, they would dig it out. But because of COVID, the very last thing I want to do is to ask my maintenance guys to touch trash that they don't need to touch. It's a high-risk behavior. And so it's something we're struggling with and trying to find a solution. And I don't want residents touching trash either right now. It's just not a good practice. But somehow our recycling stream is being contaminated, and it's a challenge we're going to have to address.
Yeah, I think the biggest culprit is plastic film and plastic bags. That's really a big no-no because it jams the machines.
Yep. What else?
There is still some confusion on the quarantine of how many days did you do this, how many days for that. So could you go over that again?
Yeah. So, Lauren, let's take the quarantine chart and put that on the front page of the Tuesday Talk. Because here's what we did. We broke the quarantine into strict and loose, and then we subdivided it into 4 categories each. So we have multiple categories, multiple levels of protection. It all is dependent on if you travel, did you travel by plane, did you travel by car, did you travel by air, did you go to the ER, did you go to the hospital, there's a difference, did you just see a physician, did you spend a night with a relative, where was it in-state, out-of-state? So we have all that, and I think the easiest way to do that is we'll just take the bottom half of the front page, we'll put the quarantine list on there so everyone can see it again.
Grant? Could you?
Brent, I just,
Go ahead, Hazel.
I just wondered what the situation was on new residents when they come in. How long should they be quarantined for, and does it vary? I'm not clear on that.
So good question. New residents currently are not quarantined at all. And they would be treated as the same as one of your family members. There are some guidelines that they have to comply with. They have to submit to a daily wellness check with the nurse. They have to go through a daily screening with their temperature checked and the screening questionnaires. But new residents who are just new residents and have nothing else going on, they are not quarantined at all at this point.
Brian, I have 2 questions. One, they relate to each other, and that first question is regarding whose protocols we're following. There's CDC, there's the governor, there's LCS, and so on. Sometimes the governor's protocol overrides the CDC, etc. So I wish you'd touch on that. And the other question is very specific, has to do with 4 tops with 3 addresses or 4 addresses. It seems to me that holding it to 3 and not letting it go to 4 is overly protective in view of all of the sort of upbeat things you talked about here today.
So the first question is the protocols. There are an awful lot of people who have published protocols. There's the Department of Health, there's CDC, there's the Center for Medicare and Medicaid Studies, there is LCS and Regency Oaks. And all of them have valuable input. And so what we did is we drafted what we call our reopening plan. And I've shared it on a couple of occasions. It's about 67 pages, and it talks about what we do in dining and transportation and housekeeping and at what phase. We are in day 66 of phase 3, and we are in section 4. So there are still 8 more sections within phase 3 to go. And so to answer the second question, we set the protocol based upon the guidance from Center for Medicare Studies, the Health Department, and CDC, but we set our standards in our reopening plan, which was approved by LCS, and then that's where we stand. So right now, under the section and phasing that we currently are allowing only 3 addresses per table. Now, at some point, there are a couple of things in the next phase. We will look at bringing coffee back to a coffee bar back in the tavern. We'll look at opening the expanded hours and services in the tavern, and we'll look at 4 families per table. But that's in the next section, so that's the next thing we will ask for. But there's 11 criteria that we must meet in order to move forward, and currently we fail on 7 of those 11 criteria. And they're not Regency Oaks based, that's county and state based. And so my best guess is that we're going to weather this storm, and then within 2 weeks, if we continue to see the flu and COVID-like symptoms continue to be close to 0, and we've seen that we saw it for 5 weeks, and then we see the downward trend. So if that continues, I would think within the next 2 to 3 weeks, hopefully before Christmas, we'd be able to look at expanding from 3 addresses to 4. Great question, thanks.
How long do you foresee before we can have lunch in the tavern?
Same answer. So that will be one of the next things we will ask for, and I think we're shooting for before Christmas.
How are the flu shot numbers?
Great question. Do you happen to have an update today? On the top of the Tuesday Talk memo, we'll give you an update on the flu shot. Very small. This is going to be a packed Tuesday Talk. That's right.
This is a question on the COVID inoculations. Will they be done here by CVS?
Great question. So the question, in case you didn't hear it, is will the COVID vaccines be given here? And so, yes, they are going to be given here, but I don't know what that means yet. And so we have contracted with the pharmacy, and I don't know if we have to run everyone through the skilled nursing or if they're going to set up clinics in each of the building. So we don't know the answer to that yet. So, and Lauren, did you want to come up? I know Lauren had something she wanted to share. Any other questions? Is that a question back there? Nope. Okay. All right.
So I have a favor to ask of everyone. On a regular basis, the number of packages that we receive at the front desk for residents is enormous. As we are approaching the holidays, and I imagine after Cyber Monday yesterday, we'll see a spike in the deliveries as well. The package procedure is the packages are dropped off, and I remember FedEx is in and out of here 5, 6, 7, 8 times a day. Same with UPS. Then the mail comes, sometimes 3, 4 o'clock, and that's getting later as their load is increasing as well. All packages must be logged because we at Regency Oaks are signing them and saying, yes, we accepted them. So we at Regency Oaks are taking that responsibility that if you don't get your package, it's on us. So we're going to fill out a package slip, we're going to put it in your box, and then you sign the package slip. So we are accounting for the fact that we have delivered it to you, or you have picked it up. A lot of times, we have many residents that are coming down to the front desk and saying, look, I just got a text that my package was delivered, and it's 11:48. They're down at the front desk at 11:49, and they want their package right then. Well, there's the stack of boxes by the front desk. My front desk staff has not gotten to logging them, sorting them, filling out a package slip, and putting it in your box. So what I'm asking is, please be patient. Please understand that you're not the only resident receiving packages. There are many residents receiving packages, and it takes some time to take the steps to make sure that you do receive your package, and there is not a problem with delivery and us getting the package to you. Does anybody have any questions? Okay. Thank you so much. I really appreciate it, and you'd be helping relieve a little bit of the stress at the front desk right now. Thank you.
All right, thank you, Lauren, and that wraps it up for today. Don and I are headed off to a Character GPS luncheon where we're going to be representing Regency Oaks, and Character GPS is one of the foundations that I have supported over the years. It raises money and does good work with young, underprivileged kids in our community, and we're excited to be representing Regency Oaks at this luncheon. Have a great day, and we'll see you later.